So it's starting to look like, to be part of this session, you had to have blonde hair. I'd like to acknowledge my co-authors, Mark Harris, Nagat Faruqi and Oshana Humiz from Centre for Primary Healthcare and Equity, and Nigel Stocks from Adelaide, University of Adelaide. I am actually the second author. It's actually Mark, Nagat and Oshana who implemented this intervention in New South Wales, and Nigel who implemented it in South Australia. So I am sort of the second choice in the presenter here. So I hope I can answer any questions or relate it well. I was already feeling a bit sort of second rate at that orange sky presentation. Now I feel like I should have some sort of clothesline and competition to open. Anyway, so I hope it's okay. So we already know about the increase in obesity over recent decades, the associated increase in health problems, etc. So I'm not going to labour that fact. But as you probably know, weight management is confusing. There is so much information out there in Facebook, radio programs, TV programs, people's friends, aunties, etc. One of the things that people who are overweight really need to manage their weight is health literacy, which, if people are not familiar with the term, it's the degree to which individuals have the capacity to obtain, process and understand basic health information and services needed to make appropriate health decisions. So it's not just health knowledge, it's being able to find and use that knowledge to manage their health. Now in Australia, most people, about 60%, have insufficient health literacy to manage their weight, or to manage their health, including their weight. And poor health literacy is sometimes conflated with low motivation to lose weight. So these are some quotes from the study I'm about to talk to. This is unpublished. One practice nurse saying, you find obese patients are often in denial. They feel it's too hard. They're just accepting of who they are and what they are. It's difficult to start motivating people to change their lifestyle. And the GP saying there's a lot of people who turn a blind eye to their weight problem and in a state of denial. I don't know how many people you know who are obese and actually denying they're obese and not wanting to manage it. So the Better Management of Weight in General Practice study that I'm here to talk about, our aim was to evaluate the implementation and effectiveness of using practice nurses in the role of prevention navigators to support obese patients with low health literacy to better manage their weight. It was a two-tiered intervention. At the practice level, we did clinical audits with general practices and discussed the results with a GP to look at how the practice might improve what they're doing in relation to weight management. We trained the GPs and practice nurses in the 5 A's of obesity management, which have been in the last 2 presentations, so you're probably already aware of them. In health literacy, I'll talk a little bit about that in a second too. Some specific training for the practice nurses in their navigator role. And we also discussed with GP the results of health literacy screening that was done in their practice. So at the patient level, the patients received a health check by the practice nurse. It took about a half an hour, which went through those 5 A's you've already seen twice, and a follow-up visit with the GP. So Mel's already done a good job of going through the 5 A's, and Elizabeth's done that. So is anybody... Nobody's going to put up their hand now at this point and say they don't know what the 5 A's are they? No. Okay, we'll move right on. But this is just an excerpt from the training. Again, an excerpt from the training. So training practice nurses, some of the signs of low health literacy without having to give a questionnaire, things like patients not filling in forms completely, frequently missing appointments, lacking follow-through with referrals, saying they're taking medications but the test results suggest they're not able to describe their medications, give them information and they'll say, oh, well, I'll just look at this when I get home. So there's a lot of ways to recognise health literacy. Quite a bit of the training was around effective communication, particularly for patients with low health literacy. Things like keeping it down to just a couple of key points, not overwhelming patients with information, plain language, being positive and empowering, drawing pictures, illustrations, asking what questions do you have, not just do you have any questions and moving on. and in particular the teach-back method, where the patients are asked to say back in their own words what they understood. It's a really good way to check that they really have understood. So looking at our BMW GP study, Better Management of Weight in General Practice, in case you forgot. It's a pragmatic cluster randomised trial with 17 general practices in socioeconomically deprived areas of Sydney and Adelaide. The participants were adult patients who were obese, had no chronic disease, including no diabetes. They weren't engaged in any weight loss medication or surgery, or none planned. The data was collected via interview, and the protocol is written up if you really want the details. We had 120 people at baseline, about 2/3 female, about half born overseas, about half had an education maximum of school. The average BMI was 37, because to be in the study you had to have a obese category of at least 1. And 78% were trying to lose weight, and the follow-up sample, the people who were still there for the follow-up data collection, were about the same. So we measured health literacy using the health literacy questionnaire that's been designed by Osborne and others in Melbourne. That has 9 domains. 3 are around their engagement with primary health care, so whether they feel supported, whether they're actively engaged with healthcare providers, if they're able to navigate the healthcare system. The 4 blue ones are around health information, whether they can find it, whether they feel they have enough, whether they understand it, and in particular whether they can critically appraise conflicting information. The green one, whether they're actively managing health, so that's, do they see it as their own responsibility, or is it somebody else's responsibility to look after them? Are they setting their own goals and working towards them? And social support, do they have enough social support to help them to manage their weight? So the health literacy questionnaire is not so much a success-failed type screening questionnaire. It's more about describing your patient or describing your patient group. So what this is showing is that this particular group scores quite, the domains in which they score the lowest scores, sorry about that, is actively managing health, critical appraisal, and having sufficient information. And looking at those, just at baseline, comparing those who were actively trying to manage their weight at the beginning of the study with those who were not, you can see that it's those areas that were the lowest were the ones that differentiated those who were trying to lose weight and those who were not trying to lose weight. Now, looking at the change in health literacy scores from baseline to after the intervention amongst the patients, as you can see, and this is really heartening, increases in health literacy scores for nearly all of the, so 8 of the 9 domains, and for 3 of those domains, that's a significant difference. So they were much more likely to report they could find good health information, that they understood that information, and also that they were actively managing their own health. This translated into relative to the comparison group, the intervention group had a reduction in weight, as against what you might even expect with any population over a 12-month period, an increase in weight. So that's non-significant, unfortunately, possibly just due to the low numbers because it was a small study, but pretty heartening. So in conclusion, the patients with obesity had lower scores on particular HLQ domains, and those trying to lose weight were associated with the same HLQ domains, which was interesting. Well, I found interesting. One was active management of health, and that's something practice nurses can engage patients in setting realistic goals, for example, in that domain. Critical appraisal, practice nurses can talk to patients about reliable sources of information or how to differentiate the good from the bad. And having insufficient information, practice nurses can provide patient-friendly written materials. So there's easy things that practice nurses can be doing in those domains that seem to be quite important for this group. Now the brief training, and it was pretty low-level intervention, seems to have improved practice nurses' capacity to support patients with low health literacy, as it translated into changes in the HLQ scores, health literacy questionnaire scores, and a small weight loss. So this underlines our belief that obesity care needs to be tailored to patients with low health literacy, and to seek to actively increase their health literacy so they can manage their own weight. I'll acknowledge the funding body. And I will note too, this study was part of the Centre for Obesity Management and Prevention Research Excellence in Primary Healthcare. I thought I'd never have to say that again because it doesn't exist anymore. But the website's still there, which has some resources. But in particular, coming out of the project, we developed a obesity management online course, which is just 1 hour and it's free and it's on the APNA site and it contributes to CPD points if anyone's interested. And I did notice there's also a health literacy course on the APNA website. And that's it.